And finally, any other irregular bleeding, bleeding after intercourse, bleeding mid-cycle, can be due to many simple things, maybe nothing, but can be associated with serious problems. And definitely if you have bleeding after intercourse, do just seek help, get somebody to look at your cervix and just check everything's all right. Now the big question is, people often ask me, and one of the biggest questions I'm asked is, can I delay my periods? And can I delay my periods before performance? Can I delay my periods? And my phone was hot, just before the Commonwealth, hot just before the Games. If you want to do that, best time is try and do it, learn about it 6-7 months before. Because yes, we can help you with your periods, we can delay periods, easy, but it sometimes needs a little bit of sorting out, and sometimes the treatment doesn't suit you. And what I don't want to do is delay your period. You don't win gold, you win bronze, and you blame me. So let's try it when you're earlier on, when you're not competing or at a competition that isn't as possibly important. But you can delay it. Now, how can you delay it? Well, it goes back, I suppose, to, let's go back to this graph here. I suppose this is it. It goes back to understanding this. So if you've got regular periods, and it's understanding what I tried to spend some time at the beginning, if you're having regular periods and you're ovulating, you have your period because of progesterone. And if you don't get pregnant, the progesterone stops being produced. And the medical diagnosis, medical definition of a progesterone is a progesterone causes a withdrawal bleed on an estrogen-primed endometrium. That's the medical definition of it. So if you're on the pill, the normal combined contraceptive pill, when you stop the pill contains estrogen, so you've got an estrogen-primed endometrium. The pill contains progesterone, so you stop the pill and you bleed because you've stopped the progesterone on an estrogen-primed endometrium. So, therefore, if you think when you get pregnant, the pregnancy produces progesterone. And by the pregnancy producing progesterone, you don't bleed. So what is the commonest cause of not having a period is pregnancy. Why? Because you've got too much estrogen. What happens in the menopause, you have no estrogen, no progesterone, and no periods. What happens when we talked about this female athlete triad? No estrogen, no progesterone, no periods. Therefore, using that knowledge, how can we help you delay your period? Well, we can create a pseudo-pregnancy by giving you more progesterone. And therefore, instead of letting this progesterone decrease, you just keep taking, if you're on the pill, you just keep taking it. And when the pill was introduced in Puerto Rico in 1956, it was given continuously. Women didn't like it. I want my periods back. So they then said, well, stop it every month or every 3 weeks to have your period. But that is a complete fake period. So if you want to, you can just keep taking the pill. And there's no reason why you can't just keep taking the pill full stop. Never stop it. Now, what happens sometimes is you do bleed. And if you bleed, when that happens, you stop it for 4 days and you go back on it because you shed that lining of the womb. So one way, if you're on the pill, you can manipulate. But if you're doing it, try it out. And probably it's better to do it just for sort of 6 to 8 weeks, 12 weeks. After that, you do sometimes get this irregular bleeding, but you can stop. Now, I think several things. There are many different types of progesterone. And I said to somebody this morning that it's a bit like there's lots of different types of alcohol. And some people like red wine, and some people get headache with red wine. Some people love white wine, but other people can't stand it. Some people love... And therefore, sometimes you've got they're all different types, the steroid ring, etc. So sometimes you've got to find a progesterone that suits you. But also, I think we can give too much. I think if you're using norethindrone, you probably can get away with you don't need 15 milligrams, you can do 5 milligrams of norethistérone. And you may, in certain people, get away with 1 milligram of norethistérone. You can't buy 1 milligram of norethistérone, so you're given 3 micronors, which is 3 mini-pill. So the lowest dose, progesterone is not dose-dependent, it probably is duration-dependent. The one that I'm using more and more, which I did my original research on, did I say 28 years ago, is utrogestin, which is natural progesterone. And natural progesterone may be better, and you can take that orally. You used to get 200 milligrams, you can just probably start on 100 milligrams, and you can actually put it vaginally, or even cyclogest or crino. So, yeah, I think progestogens are not necessarily dose-dependent, but there's a lot of different variations between individuals, and that's why I'm saying try it before to see if you can delay it.
And with the norethistérone, you can do that once a day?
Yeah. I don't think you need to use... You may find somebody needs 3 a day, but I'd start on a lower dose and go up. So going back to that, you can either take the pill continuously and stop it when you want to have a period, or you can use progestogens, of which you can use natural progesterone or synthetic progesterone, and there's many different sorts. And sadly, the one that I used to like is one called Dufastin dydrogesterone, which is off the market now. Or the other thing you can think about is this Mirena coil. If we go back to the Mirena coil contains progestogens. Go back. If you take anything by mouth, say I had a bit of psoriasis here, and I took a steroid by mouth, it would cure my psoriasis, or should cure my psoriasis, but it would give you all the side effects of steroids, make me bloated, upset my bones, and cause all sorts of problems. You don't do that nowadays. You get steroid cream, and you rub it in. And it cures your psoriasis, and you don't get the effects around the body. The Mirena coil is exactly the same. The Mirena coil is put into your uterus, and this little sleeve sits there and slowly secretes into the uterus a dose of progestogen for 5 years. I have one huge regret about this coil, one big problem. 25 years ago, I was asked to invest in it, and I didn't. If I did, I'd be buying this place. It's stopped hysterectomies by about 70%. For the right person, it's a very good drug, because what it can do, and you go back to my lawn, I use my lawn a lot. So imagine the lawn is the hormones going up and down, growing the grass. What this Mirena coil does is it just puts a great big sheet of plastic over the lawn. So your hormones are working away, but you're not going to have your period, you will not have pain with your periods. It may help premenstrual syndrome, it may help pain with your periods, but your hormones are the same. The one disadvantage as well about it is it stops periods in about 70 to 80% of people. But that is therefore, going back to my original problem, by you not having periods, it may be that there's another cause for not having periods. So I personally recommend if you've got the Mirena coil in, once every 9 to 12 months, just have some hormones done to make sure there's no other reason why you're not having periods, that you're not missing anything. It is easy to put in, but I think there's several things. One, there is a small risk associated with risk of infection, and therefore you must have swabs done before, and if you do have it put it in, I recommend, I'm paranoid about infection, I recommend having antibiotics. 90% of people love it, 10% of people hate it. There is definitely certain people who just can't stand it, and it's removed. It's done under local anaesthetic. I always advise people to have a chaperone if you do have it done, because some people do feel faint. But the nice thing as well, if it doesn't work, it can be taken out. And I put it once into somebody on a Friday, and she didn't like it. She came on the Saturday and took it out on the Monday. She just didn't like it. So think about it. 90% of people suit. And it does take time to settle in. It's about that size. It's not big. And if it doesn't work, it can be removed. But no, it takes time. So sometimes it just needs to take time to settle. And if you have 100 people, 50 are happy in the first month. The next month, 25 are happy. And it takes about 3 to 4 months for it to settle. And again, I prefer not to put it in just before competition or anything like that. Try and do it at a time that just, if it does form as a bit of crampy pains, just gives you time to settle. So it's better down to do it when you're not in the middle of competition, etc. And any concerns, then just discuss. Well, that's sort of straightforward. So I'm just worried about time. Premenstrual syndrome, which Kevin's going to talk about. Premenstrual syndrome is the only condition I know that it is the time relationship of the symptoms to your period, not the symptoms. So you can get premenstrual mood swings, depression, tiredness, headaches, etc. But also I've got people who've got premenstrual asthma. So just before their periods, they get more asthmatic attacks. Premenstrual eczema, premenstrual epilepsy, and also in France, not in this country, it is defence for murder. And I once said that to a patient, and her husband was sitting there, and he went completely white. I said, what's the problem? He said, we're going to Paris tomorrow. And I haven't seen him since. But it is in France, defence of murder. Whether it affects performance, I think is interesting, and I know Rob's got some interesting data on that. Again, it's personal. Gold medals, as far as I'm aware, have been won across the menstrual cycle. But again, monitor your period, and I think it is important to monitor your cycle, to see what you're like, because everybody is different, and everybody reacts differently to hormones. So again, back to my alcohol story, we all react in different ways, and we can't do blood tests, and it's all due to hormonal changes that cause it. We do know it's... Sorry, yeah? I think there's no evidence either way, but I think it's probably due to lack of evidence rather than... but it's not counted as a performance-enhancing drug.
Does progesterone have some androgenic?
Certain progestogens will have an androgenic effect, but whether it's enough to have a positive effect, I don't know, because it goes back to... Because if you're hypoestrogenic, you're going to have less sex hormone binding globulin, and therefore your testosterone will be normal, but you have higher free testosterone. So, but probably those levels are of limited significance. But I think I'm sure there are people who run better just before their period. There are people who run better during their period, but people don't come to me for that. They're always worried, is it having a negative effect? So I think the answer is, like Socrates, I know that I don't know. I don't know. But it's an interesting question.
What effect does the implant have on period?
The implant of progestogen, well, that's going back the same, is that's giving a high dose of progesterone. It's giving a high dose of progesterone, and it's going to stop you ovulating, and it's going to stop the growth of the endometrium. But very high dose can actually stop ovulation and cause hypoestrogen, and that's why long-term high dose of progestogen for contraceptive may decrease estrogen and may long-term have a negative effect on osteoporosis. So again, it's individual. The treatment of premenstrual syndrome, because I'm just worried about time, it's multifactorial. Lifestyle. There's a lot of good counselling, and CBT, cognitive behavioural therapy, can help. Good diet, and Kevin's going to talk about that. There may be some evidence that acupuncture can help. And it's a team approach, GP, specialists, dietitians, counsellors. But on drugs, we do know that it's due to ovulation. And therefore, if a woman's had a hysterectomy and she still has her ovaries, she can still get premenstrual syndrome. So in my mind, it should be called ovarian cycle syndrome. And it's all due to probably ovulation. It's due to progestogens. And as Rob was asking, if you're very sensitive to your progesterone, you've got to be careful which progesterone you use if you are wanting to delay your periods. So short-term antidepressants have been very effective. You only take them in the second half of the cycle, a low dose. So although they're called antidepressants, they're working on the serotonin in your brain, which has a positive effect, which is probably what estrogen does. So there's definitely help if you feel you've got some degree of premenstrual syndrome. The most important thing is keep a diary. It's it's diagnosed from history and a diary. And finally, because of contraception, I think on contraception, you've got to work out, what's your future for pregnancy? Do you want something permanent? Do you want something that's going to affect your hormones? Do you want something more natural? And do you want something that is you're in control, or do you something that is just given to you? So if you want something that is no user failure, if you want these slides, you're more than happy to have them, unless you're taking a photograph of me. No, you can have these. I can give you these slides. I'll give them to Rob. So yeah, the injection, isn't going to upset. It's in. The implant is in. The intrauterine device, or the intrauterine device is made of copper. The intrauterine system is the Mirena coil, or sterilisation, both male and female. What have more user failure is obviously the pill, the contraceptive patch, the ring, and the condoms, and natural family planning. There's more user failure there, so it depends what you want. And this is a very busy slide, but just using the Billings method and monitoring your body and working out when your fertile times is a way that is a natural method of family planning, but that failure rate is about 20. How we measure failure rate is per 100 women years, but using just that method, it's about 20 per 100 women years. And gradually, as you go up here, condoms, etc., have a better, but even better, the injectables, the pill, and then the implant are even better. So it depends when you're looking about contraception, you've got to think about what you want, what you're doing it for. Do you want it to have an effect on your hormones? Do you want to have it that you're in control, etc.? And it's several discussions. And also, if you want to have no periods, no pain with your periods and contraception, the Mirena coil may be good. If you're quite happy with your periods, the copper coil may be good. So you need to discuss it. And then finally, yes, if you do need emergency contraception, there's several different sorts which you can now buy over the counter, or if it's more than 4 or 5 days, the coil put in can be an emergency contraception. So that was a quick sort of gallop through about the time. I think the important thing is notice change. If there's change in your body, talk to your GP or talk to Rob or your other medical officer, because help is available. I think monitor your system, and if you want to delay your periods, try and learn about your body early rather than at last minute and say, can I delay my period because I've got my competition this weekend, because that can be difficult. If everybody's happy and if anybody wants to contact me, I've given out Lorna my details, but there they are, and I can always be contacted or go through Rob and I can be contacted. So I've gone over my time, but thanks very much.